I'm Dr. Bwindi Mutahunga, the Executive Director of Bwindi Community Hospital. Now, this is the ficus tree under which Bwindi Community Hospital began as a mobile clinic in 2003 by Dr. Scott Kellerman and his wife, Carol.
We first came to the Bwindi with Episcopal Medical Missions Foundation and spearheaded by Diane Stanton, the Diocese of Dallas, to assess the needs of the Batwa Pygmies.
Yeah, thankfully Diane Stanton has remained involved as head of the Kellerman Foundation.
Yes.
And what we found in the initial survey was pretty overwhelming. The Batwa had an average life expectancy of age 28 and an under age 5 mortality of 38%.
We realized that if nothing was done, that the Batwa would cease to exist as a people. Scott and I agreed to sell most of our possessions and came to the Bwindi to assist.
Now, initially, we lived next to Bishop John and his lovely wife Jocelyn and spent several days per week living in a tent, providing medical care via mobile medical clinics. Our intensive care unit was under the shade of a ficus tree. IVs were hung from the branches, dripping life-saving quinine into the veins of kids suffering from cerebral malaria, which is universally fatal if untreated.
After several years, it became apparent that a fixed clinic was required, and the neediest area that we found was in the Bahama region.
Now, thankfully, the locals in the Bahama region were very supportive. They helped build and manage the clinic.
I'm Dr. Paul Williams, and I was the first medical superintendent of Bwindi Community Hospital as it became in 2008. I came to Bwindi in 2006 with Vicky, and we found that Dr. Kellerman and Leonard had put together a great community health centre. There were around 12 people working there, maybe 10 deliveries a month, and I overwhelmingly remember treating children with malaria, children with malnutrition, and people with HIV. We both stayed in Bahama for about 4.5 years, and when we left, it had become a much bigger hospital with 60 beds, with 120 staff working in the hospital and community health program. A big concentration on providing a safe place for deliveries, and around 150 deliveries a month. A good HIV program, testing more than 1,000 people a month, and with 2,000 or 3,000 people in treatment. We built the children's ward and nutrition unit, and had a big focus on community health, trying to encourage people to use family planning, encourage use of mosquito nets, a really good collection of data in the community, and of course introduce the quality system so that people could get free healthcare when they needed it rather than having to pay huge amounts of money. I'll never forget the day when we brought power for the first time, and we turned on the lights in what at my time was called the Bitty building, and people thought that there was a miracle. Amazing to see people see electricity and power for the first time.
I took over from Paul Williams as Executive Director about 10 years ago, and working with a multidisciplinary team, the hospital now is able to offer specialist services in women's health, surgery, child health, adult medicine, and public health. And later, we also noted that there was a critical shortage of especially frontline health workers in rural areas and where they are needed most. And therefore, we started Uganda Nursing School Bwindi to train nurses and midwives, and later on also training clinical officers who are also known as assistant physicians in other areas at Uganda College of Health Sciences, Bwindi.
I overwhelmingly remember the generosity of spirit of people, how hard-working people were. you have some amazing staff that have contributed to what's happened in Bahoma over the last 17 years. People that have really dedicated towards improving their community, people with really good insight and knowledge into their community, and who want to help. And the outputs have been phenomenal. The area of Kanungu is a much healthier place. There is still poverty, there are still huge problems and huge challenges, and I encourage anyone who wants to support Bwindi Community Hospital. But the progress that has been made will never be taken away.
We've been amazed by how the facility has grown and how it has been supported by the community, donors from around the world, long and short-term volunteers and missionaries, well beyond anything we could have ever imagined.
Indeed. We initially considered that perhaps an outpatient clinic and maybe a maternity unit would be all that's possible for us to ever provide.
Now, there is a full-service hospital, very highly ranked, which is serving the needs of the whole district.
I want to thank all those who have been part of this cause and supported in various ways. We envision a regional center of excellence offering tertiary health care, leading in innovation and research, and also graduating top-notch health professionals. Thank you so much. Thank you.
This truly is a dream come true. It's all been run by Ugandans. This has all been done to God's glory.
Webale Manonga,
Makama
Kama
Simwe.
Simwe.